Thank you, Devin. And odds are you've seen those little sticks or not so small contraptions that people are huffing and puffing while out and about. Many are probably vapes. And here to tell us a little bit more about them is Nurse Christina Paris. Thanks for joining us this morning.
Yeah, hi, good morning. Glad to be here.
Yes, so we got questions today. For those who may not be familiar with vaping, can you explain what this entails?
Sure. So basically it's a small device and it has nicotine and some other chemicals that create they're aerosoled chemicals and makes a mist, and you breathe the mist in. So originally, I watched part of the documentary. There's a documentary on Netflix about vaping, and it said that originally when the people who came up with Juul, who was the biggest producer at one time, they really did want to create something that was safer for people than cigarettes, but still have that same social aspect. So anybody who smokes knows, in fact, there's even, I think, memes or jokes about that you go around the smoke shack, you would huddle around, but you would also talk about work or you'd brainstorm ideas. So it kind of had a social aspect to it. And that was what they wanted to keep, but get rid of the bad parts.
All right. So is vaping safer than smoking cigarettes then at the end of the day?
So they're still kind of out on that. One thing that they are concerned about, so for people who were smokers, many were able to use vaping as a way to quit smoking. And there are less chemicals in vape than there are in cigarettes. However, many people, especially because now smoking is so banned from places and campuses and things. So now people are doing both. So that's not good. So you have people who are smoking and vaping. It said about 29% of people who smoked now do both. And they also, the increase in potency is 3 times the nicotine that you would find in a cigarette. There's also things like nickel and lead, and then 2 chemicals that when heated form formaldehyde, which is what we use when we embalm people. So so
there's some risks there.
There are risks, yeah. And the other big thing that so people who were smoking, we wanted to quit smoking, thought vaping would be great, and it probably is beneficial to that. But kids who never smoked are starting to vape, and so that's not good. So they went from inhaling good fresh air to now putting toxins in their lungs.
Gotcha. So since vaping can be addictive, are there symptoms of withdrawal when people are trying to get away from vaping?
Absolutely. So similar to the nicotine withdrawal, you're going to feel kind of irritable, jumpy, restless. I know people would complain about having headaches. It can also cause you to feel down or sad or depressed. There's something comforting, or nicotine stimulates that comfort sensor in our brain. It can have a hard time concentrating on things, maybe feeling hungry, just plain old craving nicotine. Similar to coffee and caffeine, our bodies just get used to that over time.
Right. So can vaping cause some health problems in the future, down the road? I know it's a relatively new device. But so can we know any of that yet?
So there still are a lot of studies out. It's still kind of a gray area. However, they are seeing severe lung damage. They're seeing things like asthma being affected, lung scarring, so causing some scarring in the lungs because of the chemicals that are being inhaled, organ damage, because of the chemicals. And then there's something called EVALI, which is like an e-cigarette or vaping product use associated lung injury. And they're thinking that has something to do with maybe the vitamin E acetate, sort of building up a toxin in your body. Addiction. That's huge. And the addiction, they say that if kids make it to 20 without having any addictions, the likelihood of them going throughout their life without addictions is good. Of course, we can always, come up with things before that. So the big thing is, I guess, discouraging kids. And then secondhand exposure and explosion. Yeah, so these devices have lithium batteries that
are getting heated up.
Yeah, they can get heated up. And then, of course, they do change the cellular level of things in our lungs and put you at risk for cancer.
So there's things to be on the lookout for.
There are.
It's not just a clear fix if you're trying to wheeze off of smoking.
Right. I mean, I was thinking of there's so many health things and things that have come up recently that we just don't know about, and this is one of them. We just it's so new. We really haven't had those long-term studies.
Well, thanks for spending the time this morning and talking about this with us. Always appreciate you taking the time.
Thanks. Glad to be here.
Looking forward to next week's Nurse in the North. But coming up, we have what's trending